Hola. Here are a couple of things about the third trimester that I think that people need to know. There are a lot of talk on here about how to induce your labor in the third trimester, starting at the 38th week.
Here's the first tip. Relax.
Relax. This is going to be the last time that you're pregnant with this baby. So just relax. Your baby can't tell time. Most first-time moms
will give birth at 41 and a
half weeks. So that's 41 weeks and 3 days on their own, first-time moms. The other thing you need to know is that by inducing your labor, especially starting at 38 weeks, your baby puts on half a pound or so a week in the fourth trimester. Let your baby get nice and juicy. Let your baby grow. I understand you might be tired, but think about the health implications that are involved with trying to induce or augment your labor before your baby is ready. The other thing, did you know that your baby releases a hormone that triggers labor that says, hey, I'm ready? And then labor will start. Talk about you can start your labor with this herb or that herb.
And as a doula who's been in this job for 2 decades, I'm going to say
Either you have a midwife or you have an herbalist that would help you. Stop listening to these people on TikTok because it can cause problems. Some of the problems that I've seen with labors that are augmented with herbs that clients have done on their own, it causes the baby to go into distress. So when the baby goes into distress, what happens is they release their sphincter and they poop. And then there's meconium in the water. And now when your water breaks and there's meconium, the pediatrician and the pediatrician assistant has to come in. So then if the baby comes out and inhales some of that meconium, what then happens is that they have to suction it out. So your immediate skin to skin or your delayed cord clamping or any of those things go out of the window.
You will go into labor. The best thing to do is advocate for more time from your provider.
How do you do that?
Easy. Ask for more time. They're going to set a time on the clock for you to come in for an induction.
If you have a conversation with your provider and say, I'll come in and get a non-stress test if the baby's okay and I'm okay, then I'd like to go home and wait for labor to start. I hope this helps.